When patients call my practice, they should definitely say what it is that they are looking for. If they just have spider veins and they're really looking for aesthetic type of treatment, then they should say that. But if they're truly suffering from leg pain and swelling and discomfort, then they should say that that's what they have. And if that's what they have, then we make an appointment right away, because we don't want people to be waiting for months. And we usually see them within 2 to 3 weeks. If someone's truly having a very difficult time with complications of venous insufficiency, like let's say venous stasis ulcer, or sometimes people have superficial thrombophlebitis right on the varicose vein, then we see them right away. We somehow squeeze them in, and we see them within a day or two. When I initially see them, there's a long history and evaluation of their past medical history and also their family history. After that, we do a careful examination of their lower extremities, not only for venous insufficiency, but other differential diagnoses such as sometimes arterial insufficiency, skin diseases that might mimic this that we look for. So we go through pretty thorough evaluation. The most important thing that we have to establish when I see them is whether or not they have significant pain and discomfort from their vein reflux, or whether their pain and discomfort is not all that significant and it's just something that they would like to get treated. So I ask them a lot of questions, and the questions that are most important to patients would be, do you have difficulty standing up at the end of the day? Do you have a lot of heaviness, heavy sensation, discomfort? I would ask them whether they have difficulty at night when they come home to carry on their evening activities. Then I do the physical examination, which is really standard, to look for other problems. And after the evaluation, I can tell them, well, yeah, you have significant pain and discomfort that impairs or interferes with your activities. And if I establish that, then there is a medical indication to pursue further. Then the second thing that I need to do is get an ultrasound. I get an ultrasound. It's not just an ordinary ultrasound. It's not a simple ultrasound where you just look at the deep veins, for instance, to rule out blood clots. It's not a quick and dirty DVT study. This is a DVT study plus it's really a venous mapping and physiologic mapping study. So it takes a long time to do this. And then I give them compression stockings, and compression stockings will have to be worn, for a certain period of time. Unfortunately, for the vast majority of people, compression stockings just aren't enough. But I need to know that that's the case. And if it works, then sometimes the patient and I talk, and that's really all that they want to do for the time being. But the vast majority of people don't want to wear a compression stocking, especially in the summer. It's uncomfortable. In the winter, it's a little bit better, but some folks can't even put the compression stockings on. Those are the 3 essential steps that it takes to get them to a point where they can consider really the definitive treatment for this, which is endovenous laser treatment.